Hi everybody, it's Dr. Jeff Pierce from Michigan Sports and Spine. I don't even know what week this is, week 5 of Facebook Live. We've gotten a lot of great feedback and we have more questions to actually get into. And Nicole's told me to just get right to the point. But I do have to talk about what's going on in the world. It's hot out, even more casual today than normal. But like I told my friend, basically, if I can't present myself and what I say as a physician that's educated, I don't think it's going to help if I'm wearing a white coat or a stethoscope. So at this point, with my 20 plus years of experience and everything else, it's not hard for me to answer these questions and hopefully explain to you as a physician practicing sports medicine, dealing with spine, answering your questions in a detailed manner. I don't think a white coat's going to help. If you do, let me know. If you'd rather see me in a white coat and with a stethoscope, let me know, because I will not wear it next time either. But we'll at least get your opinion. So jumping right into it, we're hoping to get Jules in here today, but she says she's too busy. Question 1 comes from Shannon. What are the best core exercises for arthritis in the low back? So really, it's a great question. It leads into like a very detailed answer or very general. When we talk about core exercises, we started the core statement probably 20 plus years ago, before core was so common. It's not that I coined the phrase, but everybody understands it. Well, what we're doing is there's core exercises for the back. So to just simplify it, it's your abdominal muscles, it's your paraspinal muscles, which is the muscles on either side of the spine in your back. It's also your glutes and your oblique muscles. So the oblique muscles are the ones that are on the side of your waist. So if you put your hands in your pockets, that's kind of where your oblique muscles are. The core exercises, what's really difficult is people think I always do sit-ups, I'm always working my abs, I have a six-pack. The biggest issue that people are missing, that the most important part is from the belly button down to your pubic bone. The pubic bone is right over your privates. That's where the hardest part is. So when people say, oh, I have a 4-pack or I have a 6-pack, it's always the 8-pack. The last two is really what's important for the structure, for the core. It's important to have the upper ones, and those are easier to work. It's very hard to work the lower. And a lot of exercises have come out in the last 4 or 5 years that coordinate on the lower abdomen. In your back muscles, it's the same thing, but it's even harder. Like a lot of times when I examine people, I go at the top of their hip. So when I'm at the top of the hip, that's the 4th level. So there's 5 levels in your spine in the lower back. At the 4th one, that's where majority of the problems are. So when you talk about low back pain, we talk about the 5 segments in your spine that coordinates into your sacrum, which is your tailbone. That's really where most of the pain is. So most of the pain is between the 4th and 5th segment and the 5th and the S1 level, which is the tailbone. That's 85 to 90% of the back pain. The issue is, and probably the reason it is that high, is because it's very hard to strengthen those muscles that far down, both for your abdomen in front, again from your belly button down to your pubic bone, and in your back, if you draw a line right through you from your belly button down to your tailbone, it's the same thing. You want to strengthen those paraspinal muscles at that level, which is really going to produce a lot of strength and coordination. The other thing that, just taking it to the next level, is that those are the big muscles. Between every segment in your spine, there's small muscles and ligaments that have to be strong. When people say like, oh, I feel like my spine's moving on me, and some doctors will be like, yeah, the spine doesn't move. The spine absolutely moves. There is motion in it. There's less motions in certain parts of the spine, but every part of your spine moves, because that's how you actually move through your life. So if those ligaments are weak or they're stretched or they're torn, then you're looking at a problem further down the line. So when I talk about, okay, you're now out of pain, we have the flexibility, now it feels like I have too much flexibility. We need to strengthen both the core muscles, but more importantly, the small muscles. So when people talk about core simplicity, you're talking about the big muscles. to be really good, especially with low back pain and arthritic changes, you have to make sure you strengthen the smaller muscles also. So again, the simple way to look at it is it's your abdomen, your paraspinals, your glutes, your buttocks muscle, and your oblique muscles, both internal and external, are very important for that. The oblique muscles take care of, again, the side muscles that you put your hands in your pocket. Those are the rotational muscles. So, like, I get certain patients all better when they move forward and backwards, but when they move or they rotate, their pain is caused. It's because we still have weak issues with the oblique muscles. The glute muscles, a lot of times if you've been my patient or know anything about me, I'm hands-on. A lot of doctors aren't hands-on. I'm not, it's feeling the muscle tone and telling me what's going on. A lot of times, like your glute muscle, like family members or friends or even yourself will note, like, one side of your glute, your butt muscle, is not as firm as it used to be. Well, it's not because of certain, we can make fun of it and do all that, but from a medical standpoint, when your nerve is being pinched, that muscle leaves very quickly. So you need to reactivate that muscle, and that's sometimes hard to do. So we call it a firing pattern. You have to make sure the firing pattern kicks back in. And that's where you need that good physical therapist or a trainer who actually knows what's going on. People a lot of times feel uncomfortable touching or examining that area because it's considered your buttocks. It's the largest muscle in your buttocks, but it's also one of the most important muscles for low back pain also. So all that has to be addressed. The thing I want to go into next is it's not just arthritis. We talk more about arthritis in knees and shoulders and elbows and ankles. There's actually a core structure around every one of those areas. Meaning, like in your shoulder, people are like, oh, my shoulder hurts. They don't understand what core muscles are. Well, if you think about it, we always talk about the rotator cuff muscles. The rotator cuff muscles are 4 big muscles around the ball and socket. Those all have to be strong along with the ligaments within. And also, when we talk about the deltoid muscle, the muscles around the shoulder, your trapezius muscles here by your neck, all that is considered part of your core. When we talk about the shoulder, we include your shoulder blade. A lot of people tell me, oh, my shoulder hurts, and it's really just the shoulder blade. You have to take all those things in consideration. When we talk about rotator cuff, yes, those are 4 important muscles, and then there's also the labrum. So you have to examine everything from a core muscle standpoint. So say you get a ligament repaired in your shoulder, you have to strengthen that, but you also have to strengthen the muscles around it. Because if the muscles around it, especially with this COVID and the pandemic, everybody's not working out as hard as they used to. You're now saying that the core muscle structures are not as strong as it used to be. Even if it's 25% difference, that's putting that much more pressure on the joint itself. And when it's on the joint itself, it wears the joint out faster. It's more pressure on the ligaments. So if you don't have the big, powerful muscles around it and they've weakened because you haven't been working out, we just disconnected. It reconnected.
Okay.
All right. Technical difficulty. I think we got through it. But just to review, you need the strong muscles around it to support both the joints and the ligaments below. If your muscle is weak, then it's going to put more pressure on the ligaments, which is going to lead to more chance of tearing that ligament, and more pressure on the joint, which is going to wear the joint out more, which is true, very true about knees, hips, ankles. Because with the knees, hips, and ankles, the problem there is it's carrying all the weight of your body. If you're not in shape, or if you're even 1 pound overweight, you're creating 4 to 6 more pounds of pressure on all those joints. So when you look from the waist down, you look at your hip, your knee, and your ankles, for every pound you're overweight, you're putting 4 to 6 more pounds of pressure on those joints itself. And when you look over, when you're in your 20s or 30s, you can get by. But it starts adding up in your 30s, 40s, and 50s. And believe me, that's, it's true for everybody. So the better fit you are, the better way you can control the joints and your core muscles, then you're going to be, you're going to be able to last longer for the most part. Again, keeping it simple. So I'm talking about knees, and someone asked me if knee surgery is recommended, why is it necessary, and why, and what are the risk factors? So it's kind of a general question, and they didn't put their name on it, but basically what we're looking at, knee surgery is, it's not as difficult as it used to be. It's becoming more routine, but it's a broad category. So I'm not sure what she's talking about. She's just talking about arthroscopic surgery, where you have some arthritic changes. You have a partial ligament tear, what we call like a fraying of the ligament. The fraying is, if you think of like dead ends in your hair, you want to cut the dead end so it becomes healthy again. Same thing for your knee. To kind of simplify it, what we call is the meniscus. And the meniscus, I have a knee. The meniscus is the cushion part of the knee, and it does wear. There's degenerative tearing, there's traumatic tearing, there's every injury. If you're a football fan or any type of sports fan, somebody's got an ACL injury, a meniscal injury. These are tearing of the ligaments that control the movement of the knee, which has unbelievable mechanics to it, and it's very detailed. The shoulder is more detailed, the hip is more detailed, but the knee is very functional, and sometimes it's the weak point. So with the weak point, you want to continue to strengthen. When we talk about core muscles, your quadriceps are very important to keep strong. So the quadricep hamstrings are important, but for the knee itself, if you do need surgery, there's a big variety of surgery, and every risk factor changes as you go. So let's assume she's just talking about arthroscopic surgery. You're going in, you're cleaning up with the ligaments and the softening the bone, so you have less bone spurs wearing out the ligaments. That can be, you can be back up and running in 2 weeks. If you're talking about a repair of a ligament or an ACL reconstruction, anterior cruciate ligament, which is what really holds the knee in place, that and the posterior cruciate ligament, those are much longer rehab programs. Anytime you're going to try to repair something, it extends the rehab program extensively. And again, it depends on how much is going on. If it's just a cleanup, people are like, you're up and walking the next day. With all of them, we're trying to get you up walking the next day. But the rehab program is anywhere from 6 weeks to 6 months. On an ACL reconstruction, with all the players that we know, it used to be 6 months, and we're pushing it now down to 4 months. But there's a physiological change that has to happen. There has to be a development of healing that takes at least 4 months. It's hard to push it faster than 4 months, but without having a risk of re-injury. And we talk about risk of re-injury. It's not just for the athlete on the field. It's also for the line worker, anybody who's having surgery, where you're putting that kind of tension and torsion on the knee itself. So hopefully that addressed the issue. There is total knee replacements that are needed. That's for an older group of individuals. People hesitate. We talk about stem cell and PRP. I think stem cell PRP for the knee has been the most well-studied and most understanding of what's going on, and it's proven to be very beneficial. So for the listeners, for anyone else, PRP and stem cell have been very successful in the knee. So if you're contemplating, if you're having that little achy knee, like I told every therapist, if you're working on someone for their knee, they're a candidate for stem cell and PRP, because it's the only thing working towards prevention or healing. A steroid injection is great to cut down the inflammation, but if you're doing a steroid injection, which I've done for 20 plus years, you're looking at potential harm to the joint or to the ligament. When we're talking about PRP, which is platelet-rich plasma, it comes from your body. It takes all the healing properties from your blood, spin it down, and re-inject it. That creates a matrix and a cascade for healing. And then if you add stem cell, you add more of the regenerative properties. So the stem cell is a little bit more involved. We harvest that also from the body. There's other ways to get it, but the way we're going to talk right now is we harvest it from your iliac crest, which is in your back, which has the biggest reservoir of what we call mesenchymal cells, undifferentiated. So that's really where we're moving, and a lot of people are looking at it for preventative. So the thing is, if you have an injury now in your 20s, 30s, 40s, you want to be more proactive on that. And there's things to prevent, in theory and philosophy, that these are going to help prevent major surgeries down the road. and now I'm already seeing it in my practice. So there's a major benefit, and we'll be happy to talk more on that if people are asking questions. Next question. What are the side effects of spinal injections, specifically epidurals? So anybody that knows my practice, we've been doing epidural injections, steroid injections, selective nerve root blocks in the spine for years. We've got, we talk about our success rates. We feel we have a success rate not just because of the way I do the injections, because of the whole protocol system that's set up. I truly believe that when everybody's on the same page, our success rate multiplies. So we're multiplying the success rates because of my team, the protocols, and I'm not saying this is the only way to do it. If some other doctor has their protocols and their system, that mine's better. No, that's not what I'm saying. You have to go to a physician that's dealing with individuals where everybody's on the same page. And it's from the day you meet me to the program we set up to the treatment program. Like right now, spinal injections, we have a classic 8-week program where we're not going to make you 100%. Our goal is to get you to 75 to 80%. I never want to mislead the patient that this drug or this medication or this treatment is the wonder drug that's just going to save everything. No. Medicine is not like you get a thorn in your foot and you pull the thorn out, you heal, and you're all better. There's a reason why you got to that, and there's a reason of healing and recovery. And a lot of times people don't like to hear it, but the patient is the most important person to make sure of success. We can guide you and tell you in our protocols and everything we do. If you don't participate or you're not proactive with it, we're only going to get so far. We're only going to get you so far. And like I say, with the epidural injections, the true side effects, there's very limited side effects if done correctly. There's always chance of infection. There's always a chance of bleeding. The biggest risk factor that we've had over the 20 plus years I've been doing it is with people with diabetes. We do elevate their sugars. In 20 years, I've had one minimal infection, and that's it. I've done tens of thousands of injections. So it's a very safe procedure. We do it again with the pandemic and everybody worried about being sterile. We're in a sterile environment every time in our surgery center. That's the way we do business. It's the way we've done business. So we want to be able to assure you that it's just like one of the commercials, I think it's Lexus, that we're not changing because of the pandemic. We're doing things exactly the same because we've always been precautious for any type of infection in that environment. So the side effects have been minimal because, one, we do take the precaution. We've always taken the precaution, and we haven't changed. If anything, it's slowed up. Again, and what I said last week is the biggest difference is we're not letting the family members come in and come back, and hopefully in the next month or so, that will change also. So hopefully that answered that question. This is for fun. People are picking on me. Why do you like yoga so much lately? Helps my mind and body. Does it really? To be honest, yes, it does. I mean, it's fun. I'm doing the telemedicine right now, and I'm able to spend it's like a different amount of time with the patient and what we talk about. I don't know why, but it's more about what's going on at home, probably because they're in that home setting. And we've talked about, many patients have listened to me doing the yoga. A handful have made fun, but at the end of them making fun, they are actually feeling better. They feel like their body is more alive. It's like things are circulating. That's the way one person described it. Everything, like when your body's efficient, you're going to be so much better off, so much healthier. We talk about infrastructure of everything. When you build a house, you need a good infrastructure to build from. Again, if you're injured or things aren't going well, with the yoga, it's a full body thing. And that full body also, we're putting out a lot more things this week on mind. The thing that really got me thinking about is the LeBron James commercial about the mind is another muscle, it's another exercise. Here's a guy who's as fit as the game, is the most fit guy in the game. It's the same thing with the mind. So however you get to your body and mind, any way you want to do it. I'm not pushing yoga. I'm pushing this as an avenue for you to think what you're going to do, the way you're going to take a step back, especially in the pandemic and everything going on. Everybody's got different viewpoints. There's a lot of stuff going on in the world. Self-evaluation has never been more important right now. And if you can't get yourself, what they say is, if you can't get out of the way of yourself, then you're never gonna get better. So you've got to be able to take a step back. You've got to be able to self-evaluate. And sometimes that alone time, that, like I tell people, I come up with great ideas when I'm on my bicycle. That's my time to clear my head. I clear my head. That's my meditation. That's my release. That's where my brain starts being able to bring in new ideas, because it's not being cluttered with some of the daily headaches of work. And we all have work, we all have issues, I have more people coming into the office right now that are stressed out. What's going to happen when the pandemic's over? Are we going to be able to survive? I have owners of many companies that are patients of mine, and we're talking at length about the stress that they're having, where they were never stressful people before. They were able to handle because it was known. We're living in an unknown time. So it's more important to take care of what you're mentally thinking right now. And it's becoming more open. You can announce that I'm a little stressed out without thinking like, oh my God, you're someone else that I don't want to talk to. It's okay to talk about it. It's okay to express it. I have different viewpoints on that, and I won't get into it. But the thing is, you need to address it. So yoga has helped both my physical, my flexibility. I'm getting up in the morning a lot easier. The mind and body, I'm still struggling with some of the meditation. My daughter's trying to get me through it. But overall, it's definitely helped. And it's just something I've done for years. And I do it through working out, and I do it through my bike riding. That's where I do things like kayaking and things like that. That's where I get my mental release. So following up with the last question here is from Sandra. It's a long question, but basically she had laparoscopic back surgery, went to work, it kicked right back up. Now what? Claiming there's restless leg syndrome and pain. So a lot of times, I'm not always for laser surgery. Everybody wants to do the minimal, and I'm all for doing less is more. But sometimes with laser surgery, it's not enough. In this case, I don't know until I examine her what's going on, because a lot of times you will have a setback when you go back to work because you're not ready for it. Sometimes, like I talked earlier, is your core muscles ready? Are you functionally ready? Are you conditionally ready? Are you have to, when we have work injuries, we get you back through what we call work hardening. We simulate what you do at work. If you have a very difficult job, that becomes very important. Well, if you didn't have a work injury and you're just doing the typical, I had back injury, I had surgery, I didn't do all the conditioning for returning to work, you're at risk, number one. That doesn't mean you need a second surgery. A lot of times we just need to, what we call, the professional term is tweak it. So you want to evaluate to see, one, are you having recurrent nerve pain? Recurrent nerve pain is a whole different thing. If you're having recurrent nerve pain, then it's at risk. That's where we start doing injections. We start using medications aggressively to calm that down. The other thing we worry about is scar tissue forming. If there's scar tissue forming, then that's a whole other issue. I have a certain type of stretch that we do to try to prevent the scar tissue right after the day after surgery. So that's been proven to be beneficial also. So to answer your question, if you're having the restless leg, that can be from spasm, poor flexibility, or it can be from nerve issues. So the bottom line is, unfortunately, I'm going to need to see you to answer the question correctly, but it can be as simple as it's just a conditioning thing that you're going to have to work through, get your flexibility, get your core strength back, and work that up, versus is it a nerve issue where we have to do an injection, calm that thing down quickly because we don't want it to spiral, or is it scar tissue that's forming early that we got to go in there and loosen that up. If it's true nerve pain, then sometimes a second surgery is necessary. So again, I'm sorry I'm not answering it correctly. I'm giving you the options of it, but it is important for this to be evaluated if it's lasting more than 2 to 3 weeks. So, and that's a message for everything that we do. If anything's lasting more than 2 to 3 weeks, you should be healed. It's not 2 months, it's not 3 months. You need to get in and be seen. If it's me or anybody else, that's something that's very important. The biggest thing that people make a mistake is they wait too long. You get atrophy of the muscle, you get weakness, you start changing your body mechanics. Now it's not just your back, it's your hip and your knee. I have a patient that has a knee injury, now his opposite hip is hurting him. So to restore normal mechanics as quickly as possible is the most important thing. So with that, I want everybody to enjoy a beautiful day. Apparently we're going to have a little bit of a storm tonight, but it's supposed to be a great weekend. I know there's a lot going on in Detroit, and I have to say it real quick. Just with the protests and everything, I want to do a major shout out to Detroit, that we've been basically a beacon for the country, that we've been doing peaceful protests, and that's it. I want to peace out and love you all.